Here is a number worth sitting with. The human genome accounts for somewhere between 10 and 20% of individual disease risk. That leaves 80 to 90% of disease causation to be explained by something else. For decades, medicine filled that explanatory gap with a category loosely called environment and lifestyle, a catch-all phrase that implicitly acknowledged we couldn't measure most of it. The exposome concept is an attempt to change that, and it represents a fundamental shift in how disease etiology is understood and ultimately attributed. The exposome is, in the simplest framing, the totality of environmental exposures a person accumulates across their lifetime: air pollutants, chemical contacts, noise levels, light environments, psychological stress events, dietary patterns, occupational exposures, infectious contacts, and more. Historically, measuring this has been impossible. The data did not exist in any integrated, individual-level form. What is changing is the sensor landscape. As wearable sensor technology miniaturizes, and as environmental monitoring networks densify, air quality sensors embedded in urban infrastructure, biosensors that can detect circulating chemical exposures in real time. The prospect of constructing a genuine lifetime exposure profile for individuals becomes technically feasible. Combined with electronic health records and genomic data, physicians could, for the first time, look at a patient's disease presentation and ask not just what their genome predicts, but what their environment has done to their biology over decades. This reframing has enormous implications. Disease becomes less about destiny written in DNA and more about accumulated insult, a distinction that is simultaneously empowering and legally explosive. If an individual develops a specific lung cancer subtype with a genomic mutation signature associated with a specific class of industrial pollutants, and their exposome profile shows they lived adjacent to a chemical plant for 20 years, the causal inference becomes compellingly traceable. The legal liability implications for polluting industries are not hypothetical. There is also a clinical opportunity here that deserves enthusiasm. The exposome concept transforms prevention from a generalized public health message, eat well, exercise, don't smoke, into a personalized risk map. If your lifetime exposure profile shows cumulative heavy metal exposure or chronic noise-induced autonomic stress, those become specific, measurable targets for medical intervention, not vague lifestyle recommendations. The challenge, and it is a significant one, is the data infrastructure. Integrating sensor data, environmental records, health records, and genomic data across a lifetime requires interoperable systems that do not yet exist at any meaningful scale. Privacy protections for this degree of personal environmental surveillance are poorly developed. And the computational demands of analyzing exposomic data, the sheer volume and complexity, will require AI systems that are themselves still maturing. But conceptually, this is one of the most important developments in how medicine thinks about causation. Moving from genetic determinism toward a full environmental accounting of disease is not just scientifically more accurate. It is more truthful about the world and ultimately more actionable.